Welcome. I'm Jessie Marks, and I work at the Sleep Center at River Falls Hospital. Today I'm here to talk to you about counting sheep. We are going to discuss a little bit about normal sleep, common sleep disorders, treatment plans and options, and sleep hygiene. So, why is sleep important? It's just as important as proper exercise and good nutrition for optimal health. It's a necessary part of life. How much sleep did you get last night? 8 hours? 7? 6? 7? And how much sleep do you think you need? You got 7. You're pretty close. Sleep needs really vary depending on the age of life. Adults usually need 7 to 9 hours of sleep to feel refreshed. But if you were to go on vacation and have someone time you when you went to sleep and when you woke up, what would that look like? For me, optimal sleep is about 8 to 8.5 hours. I used to be one that I thought would need 9 to 10 hours of sleep, and I found that's not so true. Many of us can function on 5 or 6, but we're not going to be at our best. So actually, losing only an hour and a half of sleep each night reduces your daytime alertness by 32%, which they say now adults or Americans get about 20% less sleep than they did about 100 years ago. Studies show that being awake for 18 hours or more is equivalent to 0.08 blood alcohol content, and if you're up for more than 24 hours, it's a 0.10. I don't ever recommend drinking and driving, but drowsy driving is just as dangerous, or it can be. And the categories are by age. 18 to 29-year-olds is the population that we have to really be concerned about, but even 52% of adults that are between 30 and 64 have reported drowsy driving. So sleep is a complex cycle. It's not something that most people realize is complex, but it's alternating states. We have our non-dream sleep, which is non-REM, and there's stages 1, 2, or 3. And this happens about 75% of the night. And then our dream sleep occurs about 25% of the night. The top graph shows what normal sleep should look like. We all, once we hit the pillow, a lot of people will report that they think they're awake, and there's actually a transitional time between wake and sleep, and that's stage 1 sleep. We go on to stage 2, and we eventually get into a deep sleep, and then those dark chunks are our REM, or our dream sleep. Adults should hit their dream sleep about every 90 to 120 minutes, and those cycles get longer throughout the night. If you have disrupted sleep, it will look more like the bottom graph. There's a chunk of time down here between 2 and 3. This is a patient of ours, came in very tired and actually spends a lot of the night waking up and staying awake. They hit a little bit of dream sleep early on, and then again later in the night. Some common sleep problems are snoring, obstructive sleep apnea, parasomnias or dysomnias like sleepwalking, sleep talking, night terrors. There's chronic and short-term insomnia, narcolepsy. Periodic limb movement disorder is something that's similar to restless legs and bruxism, and I'll be touching all of these briefly. So the most common complaint from anyone is usually snoring. It's a partial blockage of the airway causing abnormal breathing patterns at night and disruptions. And I like these cartoons because what can you do about snoring? Not a whole lot. You need staying awake, unless there's another issue such as apnea. But boring snoring is what affects probably 45% of all Americans. It's the, annoying sound at night. Your airway is open during the day when you're awake, but as you start to fall asleep, those tissues kind of rub back and forth, causing that snore. Is it serious? Probably not. Just annoying for most people. And then there's snoring with snorts or riras. That's what we call in the sleep world. So snoring with snort is definitely that pig sound. It's a microarousal. The brain wakes up. So as you're starting to fall asleep or starting to snore, it's that wake up noise. There's a respiratory effort involved. So your brain picks up that you're not getting enough airflow. And it's suspected that these put people at risk for cardiovascular disease, but it is being tested. Obstructive sleep apnea is the biggest sleep disorder that I'll touch base on today. It's when you stop breathing for a period of 10 seconds or longer at a time, and airflow from the nose and mouth are blocked because that soft tissue collapses. It can occur in any age group. It does definitely increase between middle and older age. The stereotypical person people think of is Santa Claus. You have to be old, overweight, and male, and that's just not true. We have had children, teens, and really every age and body shape into the sleep center, and you'd be surprised people that do have sleep apnea. But it's estimated that 80 to 90% of people with this disorder remain undiagnosed. When you have apnea, there's a severity of index. So if you stop breathing 5 to 15 times an hour, that's considered mild. Moderate is 16 to 29. And severe is if you stop breathing 30 times or more per hour. And I do pick on my dad and my grandma a little bit in this presentation because they are both people that swore that there was nothing wrong. My dad was never tired, always lots of energy, but for years we knew he snored terribly. The last few years I had recognized that he had stopped breathing, and he was in that severe category of actually 90 times per hour that he stopped breathing. My grandma, who knew she was tired, she took naps. She said she was just getting older. It was just part of her routine. She was on the moderate side. I think it was 25 times per hour that she stopped breathing. So really I would have expected her to not be as tired as, and him to be extremely tired. But apnea is usually treated with a CPAP machine, which is continuous positive airway pressure. And I do have machines with. This is the newest machine, or one of the newer machines. It's quite small. And it's a ResMed. This is a Respironics, very similar. This is the machine unit, and this is the humidifier. But much better than the previous machines years ago that were a little bit bigger and bulkier in size. The older machines still often work, but not quite as many comfort features. So what happens during sleep apnea? When you fall asleep and you stop breathing, your heart rate immediately starts to increase. Your oxygen levels will drop, and eventually there's an adrenaline surge that will wake you up. And this prevents you from getting a deep sleep. Signs and symptoms, like we talked about before, is snoring, choking and gasping, daytime sleepiness, and this can be, even in the middle of the day while you're active or driving. Other symptoms may include restless tossing and turning, headaches, memory or learning problems, feeling irritable, the inability to concentrate, mood swings, if you have a dry throat in the morning. I would like to touch a little bit about the headaches. I know Percy Harvin from the Vikings a few years ago was diagnosed with chronic migraines, and after all sorts of testing, they found that his headaches were a cause of sleep apnea. So it really can affect people differently. But over time, if you have apnea that's severe enough and goes untreated long enough, it not only is going to interrupt your sleep cycle, but it can lead to daytime sleepiness. The drops in your oxygen level can put you at increased risk for heart attack or stroke. Congestive heart failure, we have seen that it's linked to depression and even type 2 diabetes. And so if you were to have a sleep study or we were to monitor someone's breathing, this is what normal breathing looks like on the top. Everyone's oxygen level, if we were to test it right now, would probably be in the high 90s or pretty close to 100. And your oxygen really should stay relatively normal at night. The top graph, the airflow is normal, the effort's normal, this nice deep breath, in and out, in and out. Hypopnea is a really reduced breath, and so there's a period of time where the body is making an effort to breathe, but there's just not a lot of airflow, and with that, your oxygen levels will drop. And then if you look at this next page, there's obstructive apnea on the top. So obstructive apnea is when that airway collapses. A central apnea is oftentimes where your airway is open, but your brain's not firing and tell you to breathe the way you're supposed to. And so again, if you look at the top one, this particular patient, when you have an oxygen level of about 95%, has a long period where they stop breathing, the body is making effort to breathe, and the oxygen went from 95 down to 84. took a couple breaths, and again, it happened. The bottom one is essential apnea or even Stokes respiration. There's somewhat normal airflow, and then there's periods where there's no airflow and there's no effort. Both are treatable, but if they go untreated, really can put you at risk for major health issues. So the most common form of treatment is a CPAP machine. It is usually painless. I know no one wants to go to sleep with a mask on their face, but they have gotten much better. It's effective for all types of apnea. The masks before, I brought with a couple full face masks. So if you are a mouth breather and you can't keep your mouth closed when you sleep, we used to give you a full face mask like this. And this is actually even made by the same manufacturer, these two. This one's about 5 years old. This one's brand new to the market. You can see that there is nothing blocking the eyes. It's pretty lightweight if you're to feel it. So the masks are definitely improving. There is a dental or oral appliance, and this works probably about 50% in mild cases of apnea. It's going to pull the jaw forward to open up the airway. For surgery, in the past, to treat sleep apnea, you had a tracheotomy, which is quite severe. Now there's various procedures where maybe your tonsils and your adenoids are removed, or they're going to take out all the extra tissues in your airway, and sometimes even try and open up the airway more. There's about a 30% success in mild to moderate apnea. Again, it wouldn't be a first line of treatment for anyone. And then behavioral therapy would be weight loss, although we've had people that, we have a female that's in her early 40s, she's about 5'4", maybe 110 pounds soaking wet maximum. And so losing weight for her wouldn't do anything. Avoiding alcohol and nicotine can help. Alcohol is just going to relax the muscles around your airway even more. And then positional training, like sleeping on your sides or stomach, is something that it definitely helps with snoring. And in some cases, it can treat apnea. And to train yourself to sleep on your side, you could do various things, but they have T-shirts that tennis balls have been sewn on. So if you roll to your back, it's uncomfortable, and you know to roll to your side, or like a fanny pack you wear around the back, your lower back. And again, that's just to try and remind you to flip over. So this is an actual picture of what we look at night as far as a sleep study. And I know many of you are out here looking going, that's just a bunch of squiggly lines. What does that mean? Well, this is a patient of ours, and we're looking at a 2-minute window. The top several lines are brain waves. Got the heart rate. Green lines are the legs. And then the purple is snoring. And then the bottom 2 channels are airflow and the effort to breathe. So this particular patient has severe apnea. They have this period of time where they have just stopped breathing, their oxygen dropped down to 71%, a couple field breaths. And then again, this is actually almost like 30 to 40 seconds where they stop breathing, and one after another. So I believe this patient, after we did testing, had stopped breathing about 60 times per hour. So pretty severe. Didn't really know what was going on. It was reported that they had been snoring. And so they were kind of encouraged to come in. The same person, later in the night, and this is the dream sleep again, on CPAP at the correct pressure, all of a sudden has very normal breathing. The oxygen levels are in the high 90s, 96, 97. These are the eyes. Actually pinches, rapid eye movement, and the sleep is very uninterrupted. It looks perfect. The next disorder I'd like to touch on a little bit is parasomnias, and this would be something like sleepwalking, talking. There have been people that will eat in their sleep. Nightmares or night terrors, REM behavior disorder. So initially, if we go back to like nightmares or night terrors, this is usually something that children have, and they tend to do this more, especially with the sleepwalking, if they're overtired or they're in a different environment. REM behavior disorder is something that can be actually a little bit dangerous. It's thought that people have these superhuman powers, but they're acting out their dreams, where in our dream sleep we are supposed to be almost paralyzed. Nocturnal seizures is also considered a parasomnia, but all of these can be hereditary, and like I said before, it's really something that tends to happen if you are in an uncommon environment. So kids, if you notice that they've gone to a sleepover and now they've stayed up all night or gotten really poor sleep, and the next couple nights they're home and they're sleepwalking, it's because they probably did get poor sleep. Insomnia is the inability to fall or stay asleep. It's usually a symptom rather than a problem. Or, I'm sorry, a symptom of another problem rather than a disorder. All of us have experienced insomnia at least at one point in their life. Causes can be mental barriers like stress, frustration, depression. Stimulants such as caffeine, tobacco, some of the medications. Alcohol can actually cause insomnia. I know a lot of people will think that if they have a couple drinks before they go to sleep, they actually feel like they sleep better. Alcohol will help you to fall asleep initially, but as it metabolizes in the system, people tend to actually have more interrupted sleep. And so when you have that interrupted sleep and you wake up, now all of a sudden it's hard to get back. Sleep hygiene could affect your having insomnia. This is more for people that have shift work, or if you're tired during the day, now you take a nap, you're going to find that it's difficult to fall asleep at night. If you've eaten a large meal before bed, and then technology, especially technology in the bedroom or late in the evening. Disruptive sleep environment like outdoor noises, pets, depending on the temperature of your bedroom. And then sleep disorders such as apnea, snoring, if you have an illness, these can all cause some sort of insomnia. So the first line treatment is actually relaxation, which for most people is really difficult. I know many people who have woken up in the middle of the night and now they are stressed because they're looking at the clock going, why can't I get back to sleep? I only have 3 hours before I have to get up. And your brain starts rolling and rolling, and you think more about how important it is to get to sleep, and it just can't happen. Would encourage you to take the clock out of the bedroom, take a deep breath, maybe do some meditating, and then just relax, because really the more worked up you get, the harder it is to get back to sleep. Meditation can really help before bed. Even stress management will definitely help insomnia. Sometimes it's easier said than done. So I know working full time and having young children, I really have to try and prioritize what's most important and then set aside stuff for the next day. Cognitive behavior therapy is actually, if you were to go in and see a specialist, they would put you on possibly a strict routine as far as going to sleep at the same time every night or waking up the same time. There's many different things with cognitive behavior therapy, and then medication can potentially help. Before I touch on this next one, I have notepads in the back, and I like to call it the worry pad. So it's strongly encouraged by many physicians to have a worry pad next to the bed. So if you wake up in the middle of the night and you can't get back to sleep, take this out, write it down. Maybe it's your grocery list or the project that you're working on, something that you need to remember the next day. Write it down, like I said, and then set it aside, and hopefully that will help. And then now, beliefs about insomnia. I can't tell you how many times I've heard that it's just a normal part of aging. I'm just getting older. It's normal. Or the next kind of thing is, I have to have 8 hours of sleep each night before I can function. If I don't get 8 hours of sleep, I'm not going to do well. Our sleep needs do vary from time to time. Just because you get, maybe 6 hours of sleep doesn't mean you have to wake up feeling tired. And then when I have trouble staying asleep, I should just stay in bed and try harder. You really can't try to sleep. It's a natural process. It happens. So things that you can do is go to bed when you're tired. Try to use the bedroom for sleeping. Don't bring the laptop in there and start working. But really let your bedroom be a place of relaxation. If you're not able to sleep, get up, move to another room, and only go back to bed if you're tired again. Repeat this as necessary, really as you need to. The big thing is you're supposed to get up the same time every morning. And so Monday through Friday we do that, but usually on weekends we like to sleep in. And this is something that if you have insomnia, you really should try and avoid. Avoiding naps is a good thing to do. Like I said, sometimes these are easier said than done, but it will help your overall sleep. Now, narcolepsy is another sleep disorder, and it's often mocked on TV as being, you think of the people who are walking, talking, and bam, they fall asleep. The spectrum for narcolepsy is huge. It's actually a neurological disorder that causes the brain an inability to regulate sleep cycles. So if you have narcolepsy, you fall asleep very quickly and you hit your dream sleep very quickly. I know many people will go, why is that a problem? I would love to fall asleep quickly. But these people will fall asleep at times involuntarily. They could be having conversation, and for some people, emotions will trigger like a sleep attack. Hallucinations can occur at this time as well, and people will report being in a sleep paralysis. So they are aware of maybe what's going on, but they just kind of are in a paralyzed state and they can't quite wake up. So it's an overwhelming need to sleep, and it does affect about 1 in 2,000 people. We have seen a handful of people that have come through in their late teens, early 20s that do have the disease. It will occur even if you get a full night's sleep. So narcolepsy and apnea are kind of an interesting thing because a lot of the symptoms are very similar. You're very tired all the time if you have these two often, but completely different causes. And researchers think that there is a deficiency, which they are doing a lot of studies to see if we're lacking something in the brain. Maybe we can have a medication that will change that. But treatments are usually, right now, stimulants, so they wake up the brain. Provigil's the newest one out there. Ritalin, Adderall, those are both for ADD as well, but this will help if you have narcolepsy. Lifestyle changes would be like regular napping, sleep hygiene, and avoiding extended driving periods. I just got done saying napping's not good. That's only for insomnia. If you have narcolepsy, it will actually help you function. Restless legs are those creepy crawly tingling feelings that you get in your legs. It can happen when you're awake, and it usually is more in the later evening. It's really frustrating if you have it, and if you know someone with it. I know my grandma had it for a long time, and her legs were always going, and my grandpa would kind of get frustrated, like, settle down, what you doing? And she just was kind of out of her control. There are medications. The two listed are prescription, but it will come sometimes potassium, magnesium, some over-the-counter multivitamins and supplements will help with this as well. Periodic limb movement disorder occurs while you're sleeping, and these are a more repetitious jerking. Those muscles fire, and those can actually wake you up. Sometimes the partner will notice it, but not always. So symptoms are pretty similar to restless legs, but this occurs while you're sleeping, and the medications are the same. And bruxism is an interesting one. It is usually noticed by your dentist. So bruxism is when you grind your teeth at night. It can cause damage, and it wakes up the brain. It can be linked to stress and anxiety, caffeine, certain street drugs, alcohol consumption, medications, you name it. Many things can cause this bruxism, but it's noisy. It's frustrating if you're the bed partner. I kind of laugh because I was not aware that I grinded my teeth. Apparently I've been doing this for quite some time, and my husband finally said something one time after I went to the dentist and asked him. My dentist said, wow, it looks like your teeth are kind of getting worn away. Do you know if you grind your teeth? And I'm like, well, I don't know. But I had cracked a couple molars. And so for me, that was my sign. And my husband's like, your teeth? I didn't know what noise was happening at night, but it was loud. It was very disturbing. Treatments are mouth guard or calcium and vitamin C. I wear a small little retainer, more or less, and it helps with this significantly. So some healthy sleep tips would be to cool your bedroom. They say at least 2 degrees in a drop in temperature at night. I like to keep the house between 62 and 65 when we sleep. I know that's cold for a lot of people, but it's really whatever's comfortable for you. Your room should be as dark as possible. This will just help regulate your circadian rhythm. Establish a regular bedtime. 7 days a week. It's a tough one. And to get your best sleep, your bedroom is for sleep and select activities, but really just sleep. Many people have a TV in the bedroom, and this really should be avoided. Your TV will have a blue light that's emitted, and that disrupts the brain, kind of tricks you to thinking that you should stay awake longer, and that's why cell phones or like your iPad is something that you should avoid as well. I'm guilty. My cell phone or smartphone comes in the bedroom with me. It's my alarm clock. I dim the screen as light as it will go, or as dark as it will go, and then I flip it over. Because if I were to get a message in the middle of the night and it's flashing, that's enough to even wake me up. So avoiding heavy or spicy foods in the evenings will help. Otherwise, you have the concern about heartburn or indigestion. For many people, especially children and even actually adults, is decreasing the amount of fluids you drink before bed. And exercising regularly will help your sleep. They used to say you were supposed to avoid it 2 hours before going to sleep. No, that's changed. If you're one that gets wired after you exercise, maybe avoid it late in the night, but you should be able to exercise at any point in the day and get good sleep. Touched on it already, but don't clock watch. So most people who clock watch, it's exactly that. You wake up in the night, you stare at the clock, you see that it's 2:30. Oh my gosh, now it's 3, now it's 4. When do I need to get up soon? Actually, that can make insomnia worse. So take the clock out or turn it around so you can't see it. You can't sleep for about 20 minutes or more. Get out of bed and try to do something relaxing, light reading, and go back later when you're tired. Avoiding caffeine 2 to 4 hours before bed. And they say that caffeine can actually stay in your system up to 6 to 12 hours. So if you are sensitive to caffeine, really watch that afternoon. Reduce stress when possible. Environmental noise. I use a fan or a sound machine. Our kids had a rain machine that I like to sleep with. Now it's just that peaceful, constant fuzzy noise. That way, if there's dogs barking outside, I don't hear it. If you do work, shift work, try and stick to as much of a schedule as you can. If you're traveling a lot, especially across the country, be aware of that. Relaxation techniques like yoga, meditation, stretching, these should all help you. Not everyone's willing to do it before they sleep, but whatever sort of routine helps you. As when we were young, I know my mom would say, okay, at such and such time, it's time for your bath, your pajamas, we're going to do some light reading, and it's time for bed. And so as children, they follow a routine. As adults, we need to try and do that same routine, whatever that means for you. Any questions at all? No? So if you have any questions or concerns about sleep disorders, feel free to give me a call. I work at the Sleep Center at River Falls. Otherwise, we are very fortunate. We have 2 board-certified sleep physicians. It's now Vibrant Health Family Clinics, formerly the River Falls Medical Clinic, and we'd be happy to answer any questions. Thank you.